I am Dr. Sneha, Physiotherapist at Reliance Hospital, Copenhagen. Today I'll be talking about neurorehabilitations. So, with the advancing age and the advancing era, there's a lot of changes in technology, the treatment, approaches, and the medications. So, with the changing times, the neurosciences have found another tool of approach with medical and surgical approaches, so called as a neurorehabilitation. There's a great paradigm shift in the patient care. So, neurorehabilitation is a medical process which involves regaining or restoring a function that is lost, a function that is impaired, maybe because of a brain injury, a spinal cord injury, or vascular involvement, or any movement disorders like Parkinson's. So, for example, if I talk about stroke, now many people are aware about stroke because of the awareness, the warning signs, like a synonym for it is be fast. Like balance issues, vision, face involvement, arm involvement, speech, verbal issues, and the time that you give. So during these conditions, what does a person undergo? What does a patient face? He has issues which can involve reducing the muscle strength, or there can be an abnormal tonal issue, there can be balance issues, walking difficulties, doing the daily activities, anything. All these things are eventually affecting his quality of life. What happens when the patient is admitted to the hospital for a condition, any neurological condition, maybe stroke, maybe spinal cord injury, or any vascular or nerve involvement? The patient undergoes a series of tests and has a diagnosis. Once the patient is diagnosed, according to the level of severe or the critical situation of the patient, he is either admitted to an ICU or ward setup. A rehabilitation, basically we start tracing the patient from the ICU to the wards and to the outpatient, that is we follow up the patient till the OPD. So in the ICU, what is the role of a physiotherapist? What do you feel does a physiotherapist do? Because normally out there in the public, physiotherapists are people who are working on movement. But for ICU, critical patients or patients who are unconscious, who have lower level of consciousness, what are the physiotherapists doing? So we basically work on positioning the patient, early mobilization of the patient, preventing the patient from gaining any chest complication or any other complication for that matter, post-surgery or pre-surgery, or even if it's a conservative treatment. So these techniques help the patient to regain his alertness back, get his alertness, get the response level from the patient, prevent any complications which can hamper his present state. Once the patient is shifted from the ICU to the wards, our shift changes from the alertness or the arousal to the strength. What are the main symptoms that the patient is facing? For example, it can be strength issues, it can be balance issues, it can be a perception disorder, like a person is not able to follow commands, or a person is not able to acknowledge his environment nearby. All these conditions are covered in a neurorehabilitation. So, from strength training to gait training to balance training, everything comes under either ward setup or OPD setup. So, once the patient is discharged from the hospital, we follow up the patient or we carry forward the patient to an OPD basis. In the OPD, it can be either a long-term patient which has a chronic condition like stroke or maybe spinal cord injury. We start training the patient with several other modalities. Like it can be, for example, if it's for strength purpose, we start with dumbbells or therabinds. The main focus is to gain the function back. So in the end, I would just want to tell you all that it's for the patients out there, that it's not the end of anything, rather it's a beginning. So we here at Reliance Hospital would like to just tell you that improving your quality of life, improving your self-independence and your social life is also a necessity. And these important factors can be done and recovered with the help of neurorehabilitation. Thank you so much.